You know, I had the pleasure, Dr. Glenn, of watching a documentary. And when I saw your commentary on there, and you were really referring to skin and a lot of the issues that are happening in our community around the world with skin lightening, and certain times it's used for things that obviously are cosmetic. Maybe we had some kind of burn, but sometimes it's just because of the fact that we have to learn to love who we are. We have to learn to love our skin. And that documentary so resonated with me. At the time, I didn't know that you and Doris were like close, great friends. I was like, and so it was literally probably a week later that Doris talked to me about you and your expertise and everything that you brought to the table. And we were like, oh my goodness, we have to get you on one of our Monday calls. Okay. And for her to make it happen that quick, Doris, you are truly special. Doris has been here with us, serving as our trichologist. She's been our healthy hair expert, really just giving our class so much knowledge and wisdom every single Monday. So Doris, I'm going to literally let you bring up Dr. Glenn because I know you guys have just such a history, and I want to make sure we give her bio truly some justice today. Okay, so if you can take it away, Doris.
Yes, I am, first of all, so excited to be here again and to have my good friend on. It's just amazing. And I always say thank you guys for giving up your time. I know time is the one thing we can't get back, but here at Wakana, if you still have a follicle, it has been proven that you can get your hair back. But I'm so excited to introduce Dr. Glenn, and I'm going to give the short version of her bio because the long version will take up all of our time. Dr. Marcia Glenn has expanded one of the most successful dermatological and dermatology surgery practice in Southern California to include the revitalizing and helpful service within an elegant medically supervised day spa. As a, you guys bear with me because again, surgery is Wednesday. As a practicing, as a winning researcher, Dr. Glenn is constantly paused at the forefront of groundbreaking studies and practice in the care of the most permanent organ of the body, and that's the skin. From conditions as common as acne to those as mysterious as sudden hair loss, and procedures as innovative as facial skin tighten and abdominal fat reduction. Dr. Glenn has demonstrated a sensitive and meticulous approach to resolving skin problems, including those that are life-threatening. The Odyssey Med Spa, in the natural extension of a career dedicated to innovation, comfort, and good health. For over 20 years, Dr. Glenn has been in private practice as a board certified dermatologist and has been a member of the Los Angeles Metropolitan Dermatology Society and fellow of the American Academy of Dermatology. She is a physician specialist in dermatology and director of the Pediatric Dermatology Clinic at King Drew Medical Center. Dr. Glenn earned a Bachelor of Arts in Biology from the University of Pennsylvania and her medical degree from the University of Michigan. And without further ado, I just want to introduce my friend for over 30 years, Dr. Marcia Glenn.
Thank you, Doris, for that great introduction. I'm so honored to be introduced by Miss Doris Mosley. First and foremost, she is a dear friend, but I think what bonds us together is just our commitment to our community. And she is a pioneer, a leader in cosmetology. And I've been so honored over the years to participate in what I think is one of the greatest hair events that has been founded and supported by Doris Mosley. And we are indeed a dynamic duo because in the area of hair care, one cannot thrive alone. There are dermatologic conditions that come up for both of us that we share our expertise to optimize hair health. And today I am happy to speak to her colleagues and saddened at the same time, because indeed we are facing epidemic / pandemic in hair loss. So I'm going to ask my right hand guy, right after my new husband, my first cousin and office manager, to help me pull up some slides that I want to share with you today. So Kathy assures me that we should be able to share screen.
So if you go down to the bottom of the screen, you'll see a green button that says share screen. Use your cursor. You'll see it next, but it'll be between chat and raise hand. If you move your cursor, the bottom bar will show up. You see it?
Getting close. Okay.
There you go.
All right. And George, I want to go full screen for them. And I think it's probably, let's do this.
You can hit your presentation icon at the bottom of your slides right there. Or you can go at the top and hit present.
Okay. Okay. Is everybody seeing the slides?
Yes.
Okay. And one more thing. All right, ladies and gentlemen, again, so honored to do this. And I think continuing education for all of us is essential, whether we're a patient or a cosmetologist or a physician or just a hair advocate, staying really top of our game and delving into the literature. And Doris always re-challenges me to dig deep, go beyond my current knowledge and see what's out there. And so hopefully we accomplish those goals today in terms of hair loss. I am a board certified dermatologist, so that gives me the pleasure and honor of treating the largest organ of the body, and that's the skin. And skin has appendages, and that's the nail and hair, and those are essential to our well-being. I am currently located in Inglewood, California. So why is hair more than just cosmetic? Well, it is important because it involves our self-esteem, our self-importance. Healthy hair expresses wellness, youth, and physical appeal. I'll add in wealth, because if you're not self-confident about your appearance, it's doubtful that you're going to ultimately be wealthy financially or just wealthy in spirit. And hair may help define identity, ethnicity, and even social status. It's been said by an anonymous patient that a Black man's crown is his woman and a Black woman's crown is her hair. Move that. Next slide. Okay, so why are we talking about hair today? Well, hair loss may be epidemic for African American women. And indeed, I think hair loss is really pandemic. As I was reviewing some of the literature, even in Africa, our sisters are experiencing the same hair loss as we have. Hair and scalp problems are amongst the 5 greatest reasons why ladies and gentlemen visit dermatologists today. And sadly, 51% of African American women list hair loss or hair thinning as their top hair concern. So what does hair look like? This is the structure. Special attention to the hair shaft, known as the hair. It involves 3 layers: the cuticle, the cortex, and the medulla. That's here, and it's surrounded by an external hair sheath and an internal hair sheath. And down at the bottom, you can see the matrix or the hair bulb where all hair growth begins. What is special about ethnic hair? Well, it's the curl, it's the wave, and it's also the shape of the hair. Our particularly curly hair lends itself to being dry versus straight hair where the sebaceous gland can easily moisturize. The curls, the waves in the hair make it difficult for the oil from the sebaceous gland to cover the entire hair shaft. Also, the cross section of our hair is elliptical, thus very fragile and easily breaks. And that's illustrated here, just the shape of the typical black hair. And again, that's a little bit of a misnomer because never are we typical. But when you think about the curly natural state of our African ancestors, you'll find an elliptical flat hair. So as a dermatologist, I'm called too often to look at scalps where the chief complaint is hair loss. And for me, in thinking about hair loss disorders, it's best to divide them into scarring and non-scarring hair loss. And hair loss in the medical term is called alopecia. But as I was reviewing today to talk with you and listening to various leaders in the field, to leave your patient or client with the thought that they just have hair loss or alopecia, we owe them more. Why the hair loss? What's the cause of the hair loss? Are there multiple causes of the hair loss? So that's what I'll explore with you today. Now, I have to admit that I do have an advantage over patients and your clients and cosmetologists because I can ultimately biopsy the scalp. And that's what I do if I'm not sure what category of hair loss that they have. But for patients, for clients, for cosmetologists, you are first line. You wear the scalp, you see the scalps. And if you see changes that I'll show you today, then you're the first line of defense. You may have options to change some of their hair care practices, and then also you may be the first person that will refer them to a medical professional. So in terms of non-scarring hair loss, I'm going to list some terms: alopecia areata, drug-induced hair loss, androgenetic hair loss, and certain aspects of life may happen, such as postpartum hair loss after a woman loses her hair. After a woman delivers a baby, she will have retained hair for perhaps the entire length of the pregnancy and suddenly lose it. It typically will be reclaimed. So today I'm going to focus on the number one reason why women lose hair loss, androgenetic alopecia, in the non-scarring category, although I'll give you some brief examples of some of the others. So this is alopecia areata, where you see a singular round area of hair loss. And if you look closely, you can still identify hair follicles within. They'll be stubbling or it'll look very podo orange. If you think of an orange peel, it's textured, it's not completely smooth. I actually like to see this type of hair loss because it's likely to come back. So alopecia areata, often stress-induced. From time to time, it can be caused by autoimmune problems. What type of autoimmune problems? One that we often see in the ethnic community, things like diabetes and thyroid. And if you can get in there, if you can get them to a physician and their diabetes can be regulated or their thyroid be controlled or even some sorts of anemia, that hair will come back. You would think that stress-induced hair loss would be your preferred, but as a society, sometimes it's very difficult to manage stress. And certainly with COVID-19, we're seeing more incidents of stress-induced hair loss. Now, it could be a singular patch, or it could be the entire scalp, or it could be every area where that woman or man or child or mature person has hair, like underarm or in the genital area. Now, this slide is a little bit daunting because it lists so many different drugs, drugs for cancer, drugs for hypertension, drugs for itch, some drugs that are in heavy metals that can all cause hair loss. So that can be an easy solution to hair loss, to identify what may be drugs that are precipitating what may be the challenge. Let's say if you have cancer, I think as much as we all appreciate hair, want good hair for ourselves and for our clients and for our patients, if one has an overriding medical problem like cancer, well, we'll encourage that woman or man to succumb and perhaps use many camouflage options until they can stop that chemotherapeutic medication. Now, let's turn the dial a little bit and look at male and female pattern thinness. Today, I'm going to focus more on female pattern hair loss, although many women are unaware that they're at risk of the same challenge and hormonal shifts that men have. Upjohn, who made the medication Minoxidil or Rogaine, used to have a great informative commercial that said 40% of women over 40 experience female pattern hair loss. And of note, seen in the F, G, and H below, is that that woman retains her frontal hairline and gradually thins through the top of her scalp. So that's called pattern alopecia. In the case of a woman, female pattern alopecia, and in case of a man, male pattern alopecia. This is, to our knowledge, genetically determined. It is thought that it is inherited more from the mother's side of the family. And what you see on dermoscopy or with biopsy is miniaturization of the hair follicle, so a smaller hair follicle. Now, let's move along to discuss scarring alopecias. And I think these are a little bit more grave, in my opinion. And I shouldn't even say bit more grave, but definitely more grave, because the propensity to completely recover that hair loss becomes less and less the longer the client or the patient stays away from active intervention to slow the hair loss. So the common types of scarring hair loss are traction alopecia and central centrifugal cicatricial alopecia. And I may use the term CCCA just to be expedient with your time. But there are other variants as well. There's one that dermatologists are seeing more often, frontal fibrosis. And I call on all of you to think about lupus, which is more common in African American women, that may be associated with dark, round spots in the scalp. And I must say that Doris Mosley has referred at least a few ladies when she's seen these dark spots in the scalp, and they've subsequently been biopsied and been found to have lupus. So again, for all of you who may be cosmetologists, you are on the first line in terms of health protection and intervention for good care for your clients and ultimately my patients. And then finally, inflammation is a cause of scarring hair loss. Maybe not initially. Inflammation, when it persists, can lead to hair loss. Two very common areas of infections or types of infections that can be treated early and lead to good outcome is Tinea capitis, which is fungus of the scalp. That's still around, where you'll see persistent scale more often in children, but also in mothers who have children who share the same comb. If you see that dry, scaly patch, well, and it persists for a long time, then that person needs to be sent to a health provider for culture. And then also impetigo, a yellow crusting that may occur often in a client that is braided or weaved or just has constant tension on the hairline. That person may need a medical provider. So this is a good and almost too typical example of traction alopecia, where you can see that the frontal hairline has receded in both of these ladies, at the temple on the right and frontally. This is called traction alopecia. And over time, there'll be loss of the follicular opening, and there's mechanical loosening of the hair from the follicle, and there's inflammation of the follicle. And as I mentioned, it can come from a variety of hair care practices, ranging from frequent tight braiding to tight rollers to the beautiful style ponytail to drying agents at the hairline. All can contribute to the trauma that causes traction alopecia. Now, I truly believe that Doris invited me to discuss hair loss because of this particular problem that we're seeing more and more and more, and it's called centrifugal scarring alopecia, as I mentioned, CCCA, and it starts here on the left with the widening of the part, usually at the top of the scalp. So that's mild CCCA. Over time, we look at the middle picture and we see it's moving closer to the hairline and wider close to the ears. That's moderate. And then finally, we'll find and these clients and patients are so devastated by this ultimate outcome, severe CCCA. And ultimately, if untreated, if undiagnosed, you'll see this very shiny hair loss. Now think back to that Alopecia areata that had more texture, that was more orange peel. This is completely smooth as a baby's bottom, and you can see some hyperpigmentation, some brown, and then also a white halo. And that's very distinctive for end-stage CCCA. And ladies and gentlemen, it's very unlikely that this hair will be restored. But if you look at the periphery, there's still a lot of hair to work with, that with your assistance and with medical assistance, we can keep the surrounding hair more healthy. So this is a big, long slide that I'm going to march us through because I think it's important for all of us to know about this, if not for ourselves, but for our neighbors, for our daughters, for our granddaughters and our great-granddaughters. And I'm so pleased to know personally a Black woman who is at work for us in North Carolina, a real pioneer. She, in the past couple years, has just identified a new gene for this type of hair loss. See, I think some of you thought, okay, is Dr. Glenn gonna play a blame game and say it's, you know, all hairstylist fault? Never, 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 because we're a community and there's so much that's unknown about these disorders. Because what I'll say to you really transparently, all of us know if you line up 10 African-American ladies, you can exercise the same hair care practices on all 10 of them. And 4 of them may get CCCA and the other 6 may have fabulous hair throughout their entire life. So that lets me know that there's so much more to know about hair loss. So let's talk about nomenclature. Initially, when this was identified, we called it hot comb alopecia. Then we moved to follicular degeneration syndrome, and then chemically induced alopecia. See, we were playing that blame game a little bit, and we'll come back to that, how hair practices may aggravate CCCA, but it's more the genetic predisposition that lends itself to it. And Doris and I both know a lot about diabetes. We've had a lot of family members with it. And, you know, I'll speak for myself. My dad basically died from being diabetic, and I spend my life trying to thrive knowing that I may have a predisposition to it. So I'm always exercising. I'm always watching my diet. And I think this is a way to think about CCCA, is that about a quarter of us actually have the gene for it. And for us, we may have to do less rather than more with our styling practices. So again, to recap, CCCA, it usually occurs at the vertex scalp of African American women, although I have seen it in some men. That's the very top of the scalp. And sometimes it may be on the top, but on the sides of both of the scalp. It can extend to the frontal scalp. A new gene has been identified and an autosomal dominant inheritance. So this again can be passed down directly from either parent. Now of note, a study at Johns Hopkins found that patients with CCCA also have a higher incidence of uterine fibroids. So now I'm in the business of collecting data along with Johns Hopkins and asking many of my patients, have they had fibroids? And many of us actually have. And that may be a sign to treat that person a little bit differently in terms of taking care of their hair. Now, the CCCA may be associated with a very intense itch. I know many of us grew up thinking that if our scalp itched, it just meant that our hair was growing. Maybe not. Definitely, if the scalp is burning, that requires attention. If the scalp is tender, and surprisingly, in some of the ladies with CCCA, there are no symptoms at all. And just over time, they lose the follicular opening, they get that shiny scalp, and the hair follicle is replaced with scar. So now I'm going to spend the last few moments of our discussion really talking about some solutions, and many of them are on the medical end, but some are on the clients, the individuals, and the cosmetologist end. We must try to reduce inflammation, and that's by avoiding tight, cooled hairstyles. And when inflammation occurs, consider it a medical emergency and come in for many common procedures that your primary care doctors and especially your dermatologist can offer, from topical corticosteroids to injecting corticosteroids directly in the scalp. And if there's any evidence of infection, whether it be bacterial, that would require antibiotics, oral and topical, or if there's an infection of fungus, there are oral antifungals. Now, in terms of chemical relaxers, what are some of the practices that cosmetologists can consistently do? I think essentially remember that we're applying the chemical relaxer to the hair and not to the scalp. So it's most important to protect the scalp. In terms of thermal texturization, remember just how hot Madam C.J. Walker's comb is. So we want to use it as infrequently as the client desires or more so needs, because they may need our expertise to stretch out that heat exposure and to make sure that the hot comb is used on clean and dry hair, because if it's very oiled hair, not clean hair, then some of that oil can literally burn the scalp. Now, in terms of artificial or addendums to the hair, whether it be weaves or wigs, we want to minimize tension and friction. We want to protect especially the hairline, and we want to observe for irritation if that presents as itch or swelling and rash, and then change that hair care practice. So those are general recommendations that we all can do as people who have hair. Now let's move into some of the specifics, the treatments for non-scarring hair loss, and then I'll close with the options for scarring hair loss. So alopecia areata, tincture time. Sometimes with the reduction of stress, that hair comes back. Definitely with use of topical steroids, that hair comes back. And also there's two new options on the horizon, JAK inhibitors and something called TCI. Those are very safe prescriptions. Now, something that I feel is underutilized by African American women is minoxidil. The brand name is Rogaine. It's typically applied in 2 to 5%. It's now over the counter either twice or once a day. This works incredibly well for Black women. We are actually the best responders. What isn't ideal is that the solution is a little bit wet. So for our thermal texturized sisters, they're a little bit undone by putting something so wet on their scalp. So it can be mixed with a moisturizer, and your hair care line has wonderful moisturizing products. Also for a woman or man who can't tolerate the minoxidil directly on the scalp, it can be given orally in low dose. It originates from the hypertension family. The laser hair comb is another great, fairly non-invasive option for hair loss. This gadget is about $600, has a 5-year warranty, and is used for 10-15 minutes 3 times a week. There are some hormone blockers that are more appropriate for our postmenopausal sisters and for their significant male counterparts. And what's been really great in our practice over the past couple years that's gotten a lot of buzz in the media is platelet-rich plasma. And I wanted to share one of my patients. Here she was just a year ago with, on the left, fairly significant hair loss. And I think most of us would agree that she's had a moderate to good response. She's very happy. It does require continued treatment. And it's, in a way, one of the safest things we can do, because basically we draw the blood of our patient. If it's a healthy patient, not necessarily somebody who is taking chemotherapeutic medicines or other medicines that may compromise hair loss, but for most healthy patients, even those with common challenges like hypertension or diabetes, we draw their blood. We draw off the red blood cells, and we keep the platelets, which are rich with over 8 growth factors, and we inject them through the scalp, and we can get this type of response. We initially do it once a month for 4 months, and then have a discussion with the patient whether they're a good responder or not. And if they're a good responder, we customize their future treatment as frequent as every 2 months and as infrequent as twice a year. If I had my druthers, now you know my age, I would think that this is an appropriate therapy for all women beginning at 40 when we are at risk for the first significant hair loss. And now treatment for scarring hair loss. It's not often that we can reverse the process altogether, but we can give our patients hope and guidance. We can avoid tight braiding, we can remove braids, we can redirect hair styles, we can moisturize products, especially on the hairline, and we can do careful weaving. Now, I did have privy to some of the Wakana ingredients, and I found 3 of them at least that are on the top list recommended by Black dermatologists: olive oil, jojoba oil, and rosemary, which can be stimulatory, that can be hydrating, that encourage hair growth. So definitely we encourage our patients, and we as lay people too all need to be label readers. So in terms of chemical relaxers for people with CCCA, and even children can get CCCA, we want to postpone using chemical relaxers as long as possible. Again, we want to avoid placing the chemical on the scalp. In terms of traction, we want to address this quickly. In terms of medical intervention, there are a few, including minoxidil. Even these patients are great for hair transplants, and the cost of hair transplants have over the years become significantly less. And for centrifugal scarring alopecia in particular, if someone is complaining of a lot of itch and swelling and tenderness, oral antibiotics, add topical steroids. Even antimalarials are good. And recently we found topically a diabetic medicine, metformin, that many of you may be familiar with, has shown benefit. And hair transplantation is good for scarring alopecia. As I mentioned, traction, female and male pattern alopecia as well, which is non-scarring, and for stabilized centrifugal scarring alopecia. So this is my last of 2 slides, just to summarize all of the looks. On the top, we see traction. On the top right, female pattern. On the bottom right, we see CCCA. And my final thoughts before I'm open to any questions or discussion that you may have is that hair loss in Blacks is multifactorial. Thus, a team approach is mandatory to reverse seemingly the epidemic/pandemic of hair loss in Blacks. Early diagnosis and treatment of diseased scalp and hair by medical professionals and healthy hair practices at home and by hair care professionals will assist in preserving beautiful ethnic hair for a lifetime. So thank you for your time. I am going to try to unshare so that I can see your faces and entertain any questions that you may have.
I want to say that was just amazing, Dr. Glenn. Such powerful information. And just to know that it's such an epidemic and we have 2 of our most premier experts on the line, I want everyone to take advantage of this and ask any question, okay? While we have the experts on the line, because what's going to happen is you're going to not be here next week and then they're going to ask us some questions and we're going to call you. So we want to avoid that. So thank you so much. Guys, give it up for Dr. Glenn. I mean, this was information we could have all literally took a class and paid for. Okay. Doris, right? Oh my goodness. You're figured out, I think.
Well,
Thank you.
I'm just so excited, Dr. Glenn, that you had an opportunity to look at the ingredients. I made sure of that. That's in our product that will definitely be targeted towards restoration. I'm excited about that because I knew when you seen it, you would be telling me the truth. And I'm excited because we have the answer and I'm excited about it. And it's not chemically, it is organically certified oils that Wakana took the time to research and blend together. So some of the things that you were talking about the inflammation, which is one of the leading causes of hair loss. And we do have in our product line, we have in the ingredients, we have black seed oil, which addresses inflammation. We have the pumpkin seed oil. So they did their homework and I'm glad to be a part of this team. And I appreciate you for coming on. And like Melissa said, this is information that most time we have to pay for. We don't get it for free. So you came on and gave up your time. And I know it's a vacation day for you. So I'm excited. And if you guys have questions, ask the doctor. This is the expert. So you guys get the questions in.
We have some already. In fact, there's, oh my goodness, about 97 people on the line. So this line is literally almost full to capacity, but it's exciting to see the comments too. I mean, the comments are amazing. They're telling you, thank you. There's so much information, great information, you know, life-changing, wonderful job. I mean, there's so many comments, just really people excited about it. But there are some questions that we're going to dig out as well. It says, in males who have itching and tenderness, what needs to be done? So if they have itching and tenderness.
Essentially the same thing that would be done in a woman is address it early. Don't dismiss it. I would say if a scalp is itching beyond a day or 2, then it really is a dermatologic emergency. I was watching basketball the other day, and one of the tall players I know has CCCA, and I bet he doesn't know that he has CCCA. He probably thought, oh, it was acne, or oh, I have a ingrown. Well, it's more than all of that. And if we could have seen him earlier, we could have preserved some of that hair loss, and we could have stopped him from scarring. So for ethnic folks, it's a genetic predisposition, and it's our tendency to do certain things to our scalp that may persist the inflammation. And so really knowledge is power. And although 1 in 4 of us have the gene, now we can address it in our community more openly. And the natural styles may be the greatest options for a subset of our population not to have this progressive hair loss.
And this is recorded. There are some questions about, is this being recorded? Yes, it's being recorded. Here's another question, but thank you for that, Dr. Glenn. Hopefully that was able to answer your question. If you need a follow-up to that, let us know. But here's the next question. How often should you wash and blow dry your hair if you have a relaxer in your hair? And also, how often should we use a relaxer in the hair?
Well, again, Doris Mosley is my partner in that question. But in general, I would not suggest that one shampoos more than once a week. And I feel personally that every other week is just fine too. Now, when we go into months without shampooing, then you're going to have a buildup of debris that one may be allergic to or irritated by. Don't underestimate what ingredients that may be irritating that are in many, many, many hair care products. So within reason, I would say every week or every other week is best. And then you want gentle products. You want to hydrate the scalp, but you don't want to occlude the scalp. So oils are necessary, but you don't want your most occlusive oils. So your jojoba is great. Your almond oils are great. To have products that are anti-itch, anti-inflammatory like rosemary are great. Soothing products are great. So we have to become label readers.
Also, to piggyback with you, Dr. Glenn, relaxer should not be given under 8 weeks. So, and then it should never be applied directly to the scalp, because just like Dr. Glenn said, hair is an appendage of skin. So if you're applying relaxer directly on the skin during the application process, the same thing that's happening to the hair is happening to the skin. So 8 weeks is good for relaxer. And like you say, once a week or every 2 weeks. And we have now a shampoo of all shampoos. So I just have to give you guys that. Yeah, make sure you get your Wakana shampoo, hemp-powered hair shampoo.
And before we leave, Doris, we'll have you go through all of our hair care products. And then Kathy, of course, will do just a quick presentation. I do know there are some guests on the line, so we do want to share with you who we are and how we've came together to really bring a phenomenal solution, because we know that hair and hair loss is epidemic. But let's get to a couple more questions, though. It says, if a person is interested in receiving a scalp diagnosis, what would the next steps be?
I truly believe that dermatologists are underutilized by African Americans. And the reason for that, I'm less clear about. I grew up many years ago in Pittsburgh, Pennsylvania, and there was not a Black dermatologist there, very few Black physicians. But are most of your audiences in Los Angeles?
They're all over the country.
Oh, okay. Well, with that, I want you to know your NMA, that's your National Medical Association. They have a list of all of the Black practitioners across the country. And the NMA has a subsection of dermatologists, and there are about 100 of us. So I can't promise you that there's a Black dermatologist in every city, but make sure you're not missing the Black dermatologists in your city. I also encourage you to support the Black medical schools, because that's where many of us have trained. I trained in Los Angeles at King Drew Medical Center, where 80% of the patients were Black. So I trained taking care of Black scalp. So yes, it matters. I think most of us would agree that it's preferable to see a Black cosmetologist, or at least one who's super familiar with our hair type. Same thing with your dermatologist. So seek them out soon and often. We're waiting for you. And, you know, I also want to encourage you to participate in clinical trials. I'm hoping and praying soon that there'll be more clinical trials for hair loss. That's how we found the gene for CCCA. And if you're in the Los Angeles area, although I don't have a clinical trial for hair loss right now, I have one for eczema. It's so important to have our participation so that we can be part of the success story.
Dr. Glenn, give your number.
Oh, our phone number is 310-821-7658, 310-821-7658. And I can also help you find a great dermatologist in every city. Clearly, DC and New York are a little heavy-handed with that. But you know what? If you're in Virginia, you can drive to DC. If you're in Pennsylvania, you can drive to New York. Your hair is worth it. And
Dr. Glenn, one more time with your phone number.
310-821-7658.
Thank you.
We have a comment from one of our hairstylists who's actually built a big brand here in Illinois, Chris Curse. He says, I'm a stylist from Chicago, very grateful for the knowledge. So we have a lot of hairstylists and barbers on the line, and they're just so grateful as well. Someone else says, this information is priceless. Thank you. Good nuggets. Here's another question. How will someone who has had fibroids removed yet experiencing hair loss still go about see what the next steps are for promoting hair growth?
Mm-hmm. Well, one is to acknowledge that you may have an increased risk of hair loss by the fact that you're having fibroids. The way CCCA works, it is very rare that a woman under 40 has the first symptoms, but many patients, many young women, when they first try to get pregnant, know that they have fibroids. So one is education. For us, when our sister friends and our daughters find out that they have fibroids, put them on alert that they may have an additional risk of developing CCCA. My dream will be at some point the genetic tests will be available to all of us, but it may not be fast coming because it is our problem, not their problem, if you get my drift. So if my child had fibroids and I, as mother or grandmother, have lost hair and it tends to be in the CCCA pattern, then I'm going to really advise moderation to my young daughter with fibroids. So that would be stretching out the thermal texturization, not braiding as often, not doing chemical texturization as frequently, maybe considering some natural styles as many young women, making sure that I'm shampooing correctly with products that won't contribute to inflammation, using leave-in moisturizers to calm the scalp. All of those would speak to the possibility that my daughter would evolve into CCCA. And once it becomes evident, and that can be come evident through the eyes of a cosmetologist or through a biopsy with the doctor, aggressively pursuing treatments with topical steroids, considering Rogaine, considering PRP. I pull out the great toolbox for a woman who wants to preserve her hair.
Wow. That is awesome. And ladies, I mean, we now have really taken note of that. If you know someone who's had fibroids, suffered from fibroids, to know that that could be a risk factor for hair loss, who knew? I mean, this is just great information. Wow. Someone asked a question about platelet-rich plasma. Is that considered a medical procedure for insurance purposes or a cosmetic procedure?
Well, you know what I can say, ladies and gentlemen, we may have some control over that, because currently it's considered cosmetic, but our hair loss is not just about getting thicker hair. It's about keeping hair on our scalp. And it is possible for us to lobby our political officials to make CCCA a medical treatment, and nuanced treatments like PRP reimbursed therapeutic, if you get my drift. You know, we have to pull together through our medical societies and through our aesthetic societies to lobby for these additional treatments. I was so pleased with the before and after that I showed you. And this woman felt defined by her hair loss. She had significant loss of self-esteem. And now with the improvement that we've been able to accomplish with sessions and a little bit of topics, which is a hair fiber, she feels powerful again. So CCCA may fall much in the category of vitiligo. Those patients with color loss had to really fight and lobby for vitiligo to be a medically reimbursed treatment, vitiligo treatments to be medically reimbursed. So long story short, it is now out of pocket. But if we coordinate, if we show our strength, if we really speak to the frequency of this occurring in our community, we may be able to adjust the current reimbursement.
That is awesome. There's another question regarding, this is a person who's been to the dermatologist and had many of the treatments recommended. Last January, their hair practically vaporized. I went in and had steroid injections, antibiotics. Thank you so much for this powerful information. They're sharing their experience. I mean, it's amazing what we're going through with our hair. I mean, this is really something else. Here's another question. What is CCCA and what kind of products to use? And I don't know if you want to bring up your partner in crime there, Doris, who can tell us about, because Doris, you had CCCA, right? This is your story too.
Yeah, it's back. Yes, I was crazy. I was about to lose it. I said, Marcia, I can't lose my hair. This is what I talk about all the time. And yes, I am so grateful. The ingredients were awesome. Hemp powered hair, you guys. You can go on your website, or if you're a guest, whoever invited you to this Zoom. Also, we have now hemp powered shampoo and hemp powered leave-in conditioner, which has moisture in it, which will definitely help.
Wonderful. And go ahead, doctor.
Oh, and I just wanted to reiterate what the CCCA is: Central Centrifugal Cicatricial Alopecia. And what's walked through those words, it's usually central on the scalp, top of the scalp, centrifugal meaning it winds out, cicatricial meaning that it scars. So it's so important to really fight the inflammation that aggravates this genetic potential with products like Wakana, the jojoba oil, the rosemary that calms inflammation, the virgin olive oil, and there's probably many others. And you know what I'll say honestly is I looked at the recommended products by dermatologists and just matched it to what's in Wakana, and it was already there plus more. So the key for ethnic scalps is really to calm the inflammation.
Wow. And that's so powerful when you say to calm the inflammation, because one of the things we have in our products is CBD, cannabidiol, which I know is a growing trend right now in the hair care world. Someone has a question regarding they're a personal trainer. They teach 10 to 12 classes per week. So how often could they shampoo their hair? They wear a sew-in.
Oh, I mean, you know what? They can absolutely shampoo more than it's just what they're shampooing with. That will make the difference. Because I know I used to tease about Oprah Winfrey. Oprah Winfrey shampooed every day because she had to film, but it was what they were shampooing with that made the difference. So I am so excited. Right now we have the shampoo, we have the conditioner, and we have the hemp powered drops. So you can shampoo more, especially when you're exercising like that, because now you probably have a lot of sweat build up on the scalp. You have a lot, your skin may be accelerating faster. Dr. Glenn could adhere to that. And you got all that building up, which is clogging your pores. So yeah, you can shampoo more. It's what you're using that makes the difference.
Someone says, yes, knowledge is power. Yes, we do know that. How about coconut oil on the scalp? Is that recommended on the scalp, ladies?
Well, we do have coconut oil in the product, and yes, it's a light oil and it gives a lot of shine to the hair and a lot of strength. So yes.
Is there any chemicals we should avoid in shampoos and conditioners that may strip or thin your hair?
You have the lauryl sulfates, you have the paraffin, you have the alcohol. All of those products are not good for the scalp, which will cause, although lauryl sulfate is not carcinogenic, meaning it's not cancerous, but it causes a lot of irritation. So you want to be knowledgeable of that. And like Dr. Glenn said, read your ingredients, look them up. Because when I was given um, our product and I was sampling it, I wanted to know what I was dealing with, what I was working with. So I went in and looked up every one of them, and everyone was so supportive of the other one. And when it came to inflammation, itchy scalp, weakening of the hair, all of that, all of these product ingredients was supporting the restoration and rebuilding. And I was excited. So, hey, I quickly gave it to my partner in crime and had her to check it out also.
Wow, that is so awesome. Is hydrating and moisturizing the same or different? My hair is very dry, brittle, and gray.
Hydrating is the same as really moisturizing, because you can, dehydrating is not good. Hydrating is good. That's why you need to drink a lot of water so you can hydrate the body and so your cells can be hydrated.
How should one address acne or large pimples in the scalp?
Partner.
Right. No, that's a great question. For someone that is getting a lot of acne or more commonly said folliculitis in the scalp, it may be that they're not shampooing frequently enough and they're getting excess buildup of products or oil on the scalp. A nice shampoo that's medical grade that fights yeast is ketoconazole. Topical antibiotics can be written by your dermatologist, even your primary care doctor. And if there are a lot of pimples, I would suggest, if you're not allergic, something in the tetracycline family. Doxycycline is a great one for that. So again, I think sometimes we minimize these concerns in our scalp, but again, our goal is to preserve our hair. So I consider that a medical dermatologic emergency, and I would seek medical advice straight away after I reduce the amount of, or actually increase the frequency of shampoo. So that would be the first thing I would do. But if the problem persists, I would follow up for a topical and or oral antibiotic.
And could you speak on the success rate of platelet-rich plasma, someone asked? Is that something that's highly successful? The rate of the platelet-rich plasma? Is that?
You know, it's variable. it depends upon the stage which someone comes in. Clearly, someone who's lost all of the hair isn't going to be as happy as someone who comes in when they're first starting to lose the hair. In non-scarring hair loss, the hormonal hair loss, it may be a little bit more efficient. But again, in my practice, even for the scarring hair loss, to preserve the hair that is still there, I'll use it. And to my surprise, it's been actually anti-inflammatory too, because some of those growth factors are actually anti-inflammatory. So my goal always is to really stop the itch. That's so important. So if it is within the budget of anybody with a history of hair loss, that has a family history of hair loss, or is currently losing their hair, this is such a safe try. With the exception again of somebody who has a significant systemic problem like cancer, you wouldn't want to inject their platelets back in. But for everyone else, it's so safe.
Wow,
Melissa, hello?
I'm here. Yeah, go ahead, Doris.
Okay, one of my guests is having a challenge with her computer, so she sent me the question. She's asking Dr. Glenn, the PRP, is that the same as stem cell treatment to grow the hair back?
No, it actually isn't.
Okay.
Platelets actually come from the individual. So Doris, if you came to me, I would in my office draw your blood, spin it down with the centrifuge, take off the red blood cells, keep the plasma with the platelets, and inject it with small needles back into your scalp. Stem cells come from someone else, and maybe somebody with great hair. And I think this is where actually our industry may evolve, is to be able to either take from the individual or from another healthy stem cells and inject that back. That is something I have less experience with, not saying that it's not good, but it's on the forefront, and that's not necessarily coming from the individual that has the concern. And from what I can tell from some of my colleagues, something that's a little bit more expensive because you have to purchase the stem cells, but it's in the horizon. I would say in the next 5-10 years, we may be able to pick somebody with the hair type that we want and take their stem cells, crush them up, and inject them in our scalp. That's how quickly the hair industry is moving. But it's just so important for us to be advocates for the concerns that we have specifically, like that CCCA.
There's Melissa, I seen a question on the screen, and they're asking how long, if they've had long time hair loss, how would the hemp powered hair help? I would just like to share my experience at this point. I didn't have long time hair loss, but my hair was leaving in the top. And I started using the ingredients in hemp powered hair. It took about 2 months before I started to see the difference. And 8 months I had my hair back. But just to let you guys know, it's not an overnight microwavable success. You have to have patience. And if there's no follicles, like Dr. Glenn showed you a picture of a person who their follicles were gone because it's extremely shiny, that it's not going to come back. If your follicle is dead, you're not going to get it back. And I think Dr. Glenn could probably say yes to that, but it won't do it. But if you still have that fuzz and stubbornness and follicle, there is a chance, but it just take a while. Hair does not grow that fast, especially hair of our texture or my texture. It's a slower process, but you have to be consistency. A lot of people don't. They'll purchase product and they'll put it on the shelf and expect for it to work and use it every now and then. It's not going to work like that. So if you get the product, and I suggest that you do, even though you may think you have healthy hair, but after 40, as Dr. Glenn said, things starts to happen. And if we don't catch it early, it can progress on into disaster. where it's no return. So pay attention. As John Lewis said, if you see something, say something.
Wow. Wow. We have probably about 30 more answers or questions. So we're going to pick a few just to kind of get us through. But I tell you what, we're going to bring you back, Dr. Glenn, because they have literally broken the internet tonight. I love it, right? Someone asked, why might my hair be breaking from the middle of the strand?
It could, well, I would like to just say one thing. It could be being over processed if you're using even a hot comb. Hot comb can cause permanent straightening to the hair. When you shampoo your hair, if you're getting thermally texturized, meaning you're using a hot comb, when you shampoo your hair, it should go back from scalp to end. It should revert back to its natural state, meaning if it's curly, it should curl from the ends to the scalp. If it's kinky, it should kink up from the ends to the scalp. If you're applying too much heat, that could be the reason. It could be happening. And of course, if you're relaxing and overlapping, that could be the reason. So medically, I don't know, but those are the physical practice that's happened to the hair that could cause that.
I concur with what Doris has said, with one exception. From time to time, somebody with thick, longer hair and all of a sudden it shears, that may portend the beginning of CCCA. And I've seen that. Usually that's been associated with a intensely itchy scalp, and all of a sudden the hair breaks across, as if somebody took their shears and cut it.
Okay.
Y'all better be taking some notes today, because we are paying attention. Someone asked, what are some tools you can use to manage expectations with clients and patients? Often people are hoping for a quick fix. What are ways to communicate realistic timeline and anticipated results?
It actually depends on what what you want your end results to be. Now myself personally, I don't like flat irons. And the reason why I don't like flat irons is because when you clamp down on that hair, there is no heat, there's no air running through. So that is getting intense. Most of the time, your flat irons are 450 degrees. And when you are pressing with a comb, air is getting in there still. So that's my reason why. So that one of the tools that I use, like in the last result, don't like them, so I don't use it that often. So it really depends on what you're achieving, what you're looking for, your end results. If you want wavy curly hair, you use rods, but you don't tighten them up so tight, so you're causing breakage as that hair dry. It all depends. You know, if you're gonna braid it, but not so tight. You know, so it depends. It all depends.
Wow.
I might say a consultation in the appropriate amount of time. If you're experiencing, anybody who's experiencing hair loss, when you call for your consultation, let them know it is hair loss. A good provider shouldn't rush it, because it's indeed, hair loss is multifactorial. We need to know about your family history. We need to know how you've taken care of your hair. We may need to culture your scalp. We need to look at the back of your hair, the top, the sides of your hair. We may need to do a biopsy. So it's patients all the way around, from the customer, the client, the patient, to the physician, being prepared for something a discussion that's very emotional for most women and men too. So patience and love, and also some realistic expectations as well. And for them knowing that you're genuinely on their team. So many of my patients respect the hairstylist that sends them in to me when they see that it's a progressive hair loss without any blame. You know, and just team building, including the patient. And you have to hear that woman, what are their preferences? Because some of them are like, okay, if it's going to take a lot of work, let me camouflage. And other people are like, absolutely, I want you to do everything before you consider camouflage. What I have to say to you honestly is in terms of the CCCA, there is no cure right now, and it is progressive, but it's our goal to slow down that progression.
Someone asked the question, can hair be brushed too much or overly brushed? And yes, you can, because that's part of stress. So you brush for stimulation, to stimulate the blood circulation. But if you're brushing and brushing, yes, you can overdo it. So moderately do your brushing and not so vigorously that you're going to cause problems to your scalp.
And we just put in the chat, what does CCCA stand for again? I think that question came up a few more times. They wanted us to put it in the chat, so that's there. What is the condition in older clients when their scalp becomes lighter than their skin?
Well, some of it may be CCCA because around the hair follicle, you're going to see a light halo. And then honestly, many of us, it has taken us many years to get the color on our facial skin, many years of sun exposure. For most of us, we don't start to experience hair loss until age 40, 50, 60. So that scalp naturally is going to be a little bit lighter than our facial skin. So it could be pathologic, and it can also be just the result of diminished sun exposure over years.
And this question came up twice. I want to make sure we answer that one. It says, what should be done about itching that may be caused by hair mites?
Well, this question comes up from time to time. I'll say honestly, after 30 years of practicing dermatology, hair mites is not so common. There are some folks that get Norwegian scabies, which is a mite that takes over their body and also gets in their scalp. There's an oral medicine, ivermectin, that may be best for that. But it wouldn't be where my first look would be in terms of persistent itch.
Great.
Someone wanted to know the type of brush that you get. You want to get a brush that has soft bristle. You don't want to get the stiffer bristle brush. So you just rub it over your arms. If it feels comfortable before you purchase it, it should be okay. And just, again, not vigorously, but gentle. Do your brushing.
Wow, you know what? You guys were just amazing. We could keep going on and on. I think there might be a few questions, but some of them were duplicates. So hopefully we caught every question. And if we didn't, definitely get with Doris. Doris will get you that information to you. But what we want to do now is do a quick transition. I do know there are a few guests, so we want to just take a couple minutes, Doris, to kind of have you go over the full hair care line. And then Kathy is going to show just a couple of videos, and we're going to close it out because we have went longer than normal, but I think it was so worth it because, oh my goodness, Dr. Glenn, you just empowered all of us. As you can see, no one wants to hang up. Everyone is still here listening to every word. So this has truly, truly been remarkable. And so with that being said, Doris, why don't we do this? Why don't we showcase just quickly our product line? That way you can go through the products individually and kind of just share a little bit of your expertise there. And then we'll have Kathy come up. I know she has a few videos to play, but if you would like, I can actually showcase or share the screen. If you want to talk specifically about some of the hair products, let me just see here what we have. Okay, so we can bypass a lot of this, Doris, because I know most of this was more than covered with Dr. Glenn. I think that's not the right one. 1 second. There we go. Let's do this one more time. There's those products that I'm looking for. Do you see the hair care line, Doris?
Renew.
Yes, I'm going to bring you up and you can kind of just share just a little bit about what we're doing with the hair care line.